There's a lot of cysts under the skin across his back, shoulders, neck, and arms. One in my hand and one on my eyelid. During fasting, a couple of boils popped up on my back. Boy, your lymph system is a mess, son. What causes all these cysts? What system are we in when we're talking about cysts and boils and things? Talking about the lymph, but truly interstitial, because a lot of these cysts and boils have blood in it, right? So that is interstitial fluid. 75% lymph, 25% blood. You see that in juicy pimples, in boils and things like that. So it's interstitial. Well, why would your interstitial fluid back up on you? Some blockage somewhere? Common sense. Well, the blockage, in our opinion, and what we teach, is the kidneys. Well, listen to this. You've got right kidney pain. Now, medical doctors wouldn't even look at that. It's like, no. You get tumors in horses, you get tumors in dogs. You can see what if you get the same thing. And what system is a tumor or a cyst from? They're not big blood clots. Lymphatic clots. They're lymph clots, if you want to call them that. They're sewage backed up, and the body's smart enough to pocket it. Let me put this as a holding tank. Let me pocket all these acids right now, because the nodes are backed up. I'm not getting rid of these acids, and I'm going to store them. That's why the tumor doesn't kill you. I am writing you today about some friends of mine. They have a 6-month-old girl who was recently diagnosed with polycystic kidney disease. This little girl, his lymph system has been backing up, not only in her whole body, but in her kidneys. That's where the polycystic type of situation is. I don't care whether it's cysts, whether it's tumors, it doesn't matter. All starting from the same thing. You're losing filtration. Well, why wouldn't she? Again, we are working on so much genetic problems. This is what I was telling you guys. You guys are the saviors. You guys are the saviors of these kids, because medical doctors, they're way out of their field. They have no clue. They don't know how to fix anything like that. And so you want to wait till that happens? You're going to lose your children. You guys are the answers, and you just have to realize that. You got to get into this girl. What kind of diet would you put this girl on? She's 6 months old. Fruit. She needs to be on fruit right now. She's 6 months old. And I'd move that. If she's on any type of milks and things like that, You want to go to at least coconut milks and water, and you want to go to the fruits, the grape juices, the apple juices. By now, you're probably playing with some apple sauces, things like this. But you want to save this little girl, because this is cancer coming big time. I mean, this is lymphoma. This is the lymph system. The kidneys are the lymph system, guys. So, what are you going to do? You're going to give this girl some herbs for the kidneys? So I would give, if it was me and my little girl, I'm going to give this girl Lymphatic 1 liquid. I'm going to give this little girl at least 1 kidney farm. She's only 6 months old. But I'm on her weight. I'm only going to give her 6, 7 drops, maybe at the most, maybe back to 4. I'll give her a little more kidney drops than I would lymphatic drops. I might give her, say, 3 or 2 drops of Lymphatic 1, and then I'll give her maybe 5 drops of kidney. At the same time, I think endocrine gland would be very, very appropriate, because her adrenals are going to be down with the kidneys being down. Who knows what else is down, pituitaries, you see all that out there now. So a few, maybe 5 drops of endocrine gland. So now you've got a little bit of lymphatic, which is going to address the tumor in the lymph system. You got the kidney, which is the doorway, and you got the adrenal, which controls the doorway, and the other organs and the other glands. So just those 3 formulas is pretty good. Just if you just started with those 3 formulas, and at the same time you change that diet, because if you don't get her off the milks, she'll lose them. She'll have tumors on them. And of course, you know how they deal with tumors. We'll just cut them out, which is understandable. If you don't know what causes something, and I can understand them cutting it out to help you, but you guys know better. You guys are much smarter, and this is the time to get this little girl. You don't wait. She'll be okay until she becomes an adult. Oh, really? That kind of thinking is ridiculous. That kind of thinking leads you to death and leads you to bad roads. You've got to take care of this little girl now. You don't wait till she gets older. No, because she'll have a lot of tumors in her. When you got cysts and stuff already, oh my God. I am planning to do fasting to get rid of my breast cysts. Good idea. I would definitely, now keep in mind, if you're having breast cysts, kidneys. So you got to get those kidneys filtering. Key. So get the adrenals and kidneys up and going, so you have this pathway opened up, because right here's your kidneys for each breast, just right there. and get your lymphatic formulas going, and you'll pull those cysts right out of that breast. Absolutely. This is all lymphatic. This breast stuff is all lymphatic. Lymphatic, lymphatic, lymphatic. But they lead to breast cancers, you know. And that's what they're suggesting here with that diagnosis. All right, what's PCOS? You got to get used to that polycystic ovarian syndrome. Polycystic means many cysts. Many, poly, many. And cysts are what? Blood problems? No, lymph problems. So what's going on with this gal already? Kidney and adrenals, right? I want to get pregnant, but I want to be healthy. Well, honey, I'm going to tell you this. Clean up your bowels. Go into the kidneys and adrenals. Clean up all this so you can quit growing these cysts on the ovaries. But I can say that I also highly suspect you're pituitary. Now, the best thing to do is take the female reproductive formula. That is a pituitary formula. Don't tell anybody. And it also is an ovarian uterine formula. So the female reproductive formula, I suggest stop trying to conceive for a little while and get yourself healthy, because with the female reproductive formula you can conceive real quick. That would not be preferred, because we want you to get time to get your kidneys and adrenals healthy before you say, here my child, here's my weaknesses. One of these said POTS, which is polycystic ovarian syndrome. One of these somewhere. Where you're popping multiple cysts on the ovaries. But you're doing that on the bladder, on the kidneys. I mean, this is just the lymph system, and this is what happens when you have kidney and adrenal weaknesses. Ovarian cysts and anything endometrial, like endometriosis and stuff. Ladies, what is this? You're going to have to help me out. You're right. This is the lymph system. Ovarian cysts, endometriosis, fibroids, uterine fibroids. This is all the lymph system, not going anywhere quick. You can equate that to man's prostate and prostatitis, that sort of thing. Then we get cysts on the kidneys and in the bladder, tumors. I mean, this is all the lymph system. Tumors and cysts and boils and pimples and fibroids and fibrocystic problems, this is all the lymph system. It's all the lymph system. It's going to get real simple on you, and so it might be too simple for a lot of people to understand. I find it amazing, so you forgive me, but it just boils down to the fact that the body's nothing but cells and two fluids, and there's only two sides of chemistry, and which side of chemistry is the owie side? Yeah, it's the acid side. That's the I've got a pain in my shoulder side. That's the one. I had an MRI scan which came back fine, apart from a tiny cyst in the front part of my head. Now listen, that's evidence right there that your lymph system is at issue here. Tiny cysts, no big deal. Oh yes, it is a big deal. Tiny cysts can have tumors associated with them. So you want to just get your lymph system moving, clean up your GI tract, because this is something you want to take care of here. You don't want any cysts growing on the head or in the head. Definitely want to address your lymph system. That'll pop the pressure out. Apparently could have been there since birth. Yeah, but things never stay the same. Don't ever think anything stays the same, because that's not true. Nothing in life ever stays the same. Everything is in constant flux. Nothing really static here. In terms of calcification relating to cysts, anytime you see acidosis, you're going to see the lymph system that's hanging around a while. Because if your lymph system's moving, it's a lipid-based system, and if it's moving, then it doesn't have a chance to get overly anionic, overly coagulated, dehydrated, because it's moving and it's being filtered through the kidneys. And that's part of the problems we face, is the inability to move lymph. And so then, obviously, as we talked about just a few minutes before, calcium is what the body comes in and uses to fight that. And so now you see calcifications, you see your cysts and tumors, you can also see cholesterol and lipid deposits and all these things like that. So you're just seeing the reality of acidosis. Now, the reality of detoxification is that it takes the reality of acidosis away. I love that. It's as simple as it is. Because there's only two sides to chemistry. What's the big deal? You know which side of chemistry your body's on. You simply got to get on the other side. That's simple. And you guys are really getting that.